So hi everyone, my name is Nick Witan, and today I'll be presenting a presentation on quality of life and the effective implementation of PBS. I'd like to firstly take this opportunity to thank Louis and his team for putting this event together and also for asking me to speak about something that I do feel extremely passionate about. So who is Nick Witan? Who the hell am I? So I've been within the health and social care sector for just over a decade and a half, predominantly overseeing and supporting people with learning disabilities. To say that I'm passionate about the topic of quality of life is a massive understatement. Massive understatement. And I'm a massive fan of PBS. I love PBS. I think it's underutilized, not appreciated. And I think it's just, it's a brilliant framework and a mindset. So I'm also the founder of the Just Care campaign. So the Just Care campaign is about raising awareness around people we support and care for having the right to have a good quality of life, and us as a sector moving away from just care where basic human needs are met. And I'm also currently hosting a podcast called the Just Care podcast, which I'm enjoying it. I'm a bit addicted to doing actually. So the podcast is around, again, raising awareness around the importance of quality of life for those we support and care for. And I have people with lived experience and also healthcare professionals who come on as guests, and we discuss what quality of life looks like to them personally. Then we look at challenges that they've come across that relate to quality of life that can negatively impact quality of life. Then we look at solutions. So it is solution focused. So when I use the term just care, this is just to kind of clarify what exactly I mean, because it may be kind of slightly new terminology for some people. So just care versus quality of life. So with just care, I would say that people's basic human needs are met, and we don't go much further above that. So people are kind of fed and watered, they've had their medication, they're in a safe place, they've got a roof over their head, they'll do a weekly food shop once a week, and their mum comes to see them every Sunday. That's just care, in my opinion, the basic minimum that we are basically doing support-wise. So quality of life for me, on the other end of that, is where we are aiming to meet all of the person's human needs. That's what quality of life looks like for me. So back to just care, when it comes to potentially the person we support, or MDT in some cases, not having very much input into how the care and support is to be provided, where on the other end, where we're talking quality of life, we are talking about person-led support, where the person in question has had input. We have spoken to them directly about what they want their support to look like. Do they want to learn new skills? What they like to achieve? Do they have any goals that they want to work towards? That's what person-led support is, in my opinion. So back to just care. So this is when we're supporting people just to survive. Okay, so people are surviving day to day. They're well, they're safe, but they're just surviving. So quality of life wise, we support people to thrive. So we basically provide person-led support. They are thriving, they're developing if they want to, and the support is provided in the way that they wish it to be provided. So back to just care, we meet regulatory expectations. So that could mean that we aim to get a good via CQC, for example. So quality of life wise, it's more about we are guided by our moral obligation, because the people we support are human beings. So if you're guided by a moral obligation to do so, you will go above and beyond what just care is anyway. So what does quality of life look like? So I have spoken to many healthcare professionals, and there's a debate around what does it look like and how do I identify it and things like that. So it's actually a lot simpler than a lot of people think it is. So quality of life is different for everybody, and it depends on whose lens you are looking through. So there will be nobody on this call, for example, today who is exactly the same and will see quality of life as the same as somebody else. So we have to bear that in mind. It's important to consider the things that are important to them because they differ from person to person. how I've just mentioned that. So we need to identify what's important to these individuals and use that as the base and the foundation for how we provide support to them. So quality of life is also fluid. It can change over time. So if we're able to identify I don't know, what Bob's quality of life looks like today, that may not be the same in 2 months' time or 6 months, further down the line. So it is something that can change, and we need to be able to also adapt to facilitate that change over time. So person-led support allows us to take all of the above into consideration. So if you or your family member required support or care, would you want them to thrive or would you want them just to survive? So this may be a bit of an obvious question, but we need to put ourselves in the shoes of the people we support more regularly, I would say. So we have a legal duty of care to the people we support, but everything I'm discussing today is above that legal, requirement, the duty of care. We're talking about human beings here, so there is a lot more to it. And taking that into consideration should dictate ultimately the level of support that we provide. So I used to have a bit of an issue with doing polls on LinkedIn. It's kind of subsided recently, you'll be glad to hear. So this poll that I posted is doing whatever we can to ensure those we support have a great quality of life, a moral obligation. So as you can see, 100, the votes were 100% for yes, which I do think is meaningful. So Maslow's hierarchy of needs. So Maslow's hierarchy of needs actually applies to everybody, whether you receive support, whether you receive care, whether you don't, if you're a staff member, if you're a person with support, it applies to everybody. So if you look at the 5 stages here, the 5 levels, you will see that the bottom two I have marked as just care. So that's what I believe. Unfortunately, too many people across the sector, the people we support, are receiving the basic standards which equal just care, which I do not feel is acceptable. And I think we need to educate ourselves as a sector as to what the minimum expectation should be, because we should be aiming ultimately to fulfill all 5 levels for the people we support. Also, if somebody's needs are met, they're not going to feel the need to communicate that they have an unmet need as often, which may result in, and I don't like this terminology at all, having an incident, etc. So if somebody's human needs are met, or we do the best we can, there's going to be less, they're going to probably feel less opportunity to communicate the fact that they have an unmet need. So is a mindset shift required across our sector? So I would very much like us all to move away from just care being provided, but there's a couple of things we're going to have to do to get the party started. So as a sector, we should be acknowledging that quality of life for those we support is a priority. It's not a secondary option or something that, maybe we'll get round to it. We're dealing with human beings. Okay, so once as an organizationally speaking, if you place quality of life at the forefront of what you're doing, that will drive the level of support that you are providing. I do feel that we have to also place ourselves in a position to be able to facilitate this. So staff training, staff's awareness around quality of life, things like PBS. And I think the frontline staff who are providing direct support, we need to be able to communicate our expectations to them. So, for example, if we are interviewing somebody for the role of support worker, I think we should be communicating the fact to them that it's not just about, medication and personal care and going out and, visiting friends and family and taking part in activities that they like and engagement. It's about we are there to facilitate a good quality of life for them. So that goes a bit above and beyond. And I feel if we communicate such sort of things in interview stage and we reinforce this throughout, general Monday to Friday with staff teams, I think there will be a big improvement generally. So challenges around successful implementation of PBS. PBS is an amazing framework which the main aim of PBS is to improve quality of life. So if we get PBS right, the byproduct is that people we support are happier and they're getting their needs met, which reduces the occasions where they may feel it's necessary to communicate that they have an unmet need. So staff teams who provide direct support, do they need to understand quality of life before PBS related training takes place? So another poll, because as I said, I do love a poll. So do frontline staff in health and social care need a thorough understanding regarding quality of life before they can effectively provide PBS? So 95% have voted yes, 2% no, and 2% were unsure. I wouldn't necessarily say training wise or discussions around quality of life are separate to PBS training, but what I'm trying to get at here is I feel that conversation, whether it's part of your PBS training or not, it should come first before you go into PBS to lay the foundation so staff teams have those light bulb moments as to what the expectations are moving forward when it comes to the level of support that we're looking to provide. I do feel, unfortunately, that there's a barrier between staff and the people we support. I wouldn't say it's us versus them, but I think there's a natural barrier that we currently have in place, which it doesn't positively contribute towards people having a good quality of life. So we need to ensure that our staff teams are seeing the people we support as human beings and not just people we support. So I'll give a quick example. I was working alongside a gentleman historically who was becoming anxious throughout various times of the week. And I mentioned to staff, maybe this gentleman is feeling, maybe he's feeling, he's agitated. And that could be because he wants maybe sexual relationships, etc. So he's sexually frustrated, and the look on the staff team's faces, they were in disbelief, thinking, what do you mean he could be sexually frustrated? So the people we support do have, as I've said, the same human needs as we all do, and it's breaking down that barrier. I do also feel that when we place staff teams in the shoes of the people we support, it makes things relatable rather than we are the staff, they're the people we support, the human beings. So once we break down the barrier, I think the whole thing is a lot more fluid. And I do think that making PBS training relatable for staff is important. Put them in the shoes of the people we support. What are their triggers? What helps de-escalate them? Maybe do a mini PBS plan that's around them, and then they can relate more and they kind of get it and have those kind of, light bulb moments, as it were. So a couple more polls, because I do love a poll. So should staff looking into their own behaviors / what drives them be a part of support worker training PBS wise? So we had 93% yes, 0% no, 7% it wouldn't help at all. And a second poll, just as a treat on the same slide, how important is it to put frontline staff in the shoes of the people we support when it comes to them understanding PBS? 100% voted that's important. So face-to-face training, PBS related training for the frontline staff, our staff team. So PBS as a concept and a framework, it can be quite complex. And if your frontline staff do not understand PBS, ultimately we are failing the people that we support, the human beings that are in our care. We are failing them because we are not facilitating the staff teams to give them the life that they could have. Okay, so e-learning for a topic like PBS is not sufficient. And if anyone disagrees with me there, I'd love to hear from you. I'd love to have a conversation with you on that. So face-to-face training when it comes to PBS allows for engagement. When staff are engaged and they're around other people and you're dealing with the person facilitating the training, there's opportunities for engagement. There's opportunities to confirm understanding. If they don't understand a concept or they haven't quite grasped something, there's an opportunity for them to speak to whoever's facilitating that training and confirm their understanding. So when they leave that room and the training's concluded, they can leave with their understanding sort of full and how it should be. So also, if we do provide PBS face-to-face training, the people who work for organizations and the staff teams, depending on who they are, they may have a learning style that differs to other people around them. So if we provide face-to-face PBS training, we can then also, if we find this information out previous to the training, which we should be doing, we can facilitate the training in a way for them to get their learning style met, so they can actually learn and it will be a productive training session. So another poll: should PBS training face-to-face, of course, be made mandatory for those organizations who utilize PBS? So 95% yes, 5% no, and the other one was just for my own kind of bit of humor that I threw in there. Maybe I shouldn't have done that. So in my experience personally, because when it comes to PBS, I don't claim to have any PBS related qualifications. I'm just very passionate about it. I've seen what it can bring to someone's life when it comes to those we support. I have noticed that the knowledge PBS wise within organizations can be very, very top heavy. So it's all well and good having really effective and passionate PBS practitioners within your organization. However, staff teams and frontline staff are the ones spending the majority of the time of the people we support. So I believe, and this is common knowledge, but it needs to be reinforced, because I don't believe it's in practice enough across the sector. Practice leadership is a key element of PBS. Okay, you can see on your website that you practice PBS, but in reality, do you? So practice leadership allows for coaching of staff, observation of direct practice, modeling, feedback, and opportunities for praise. When a member of staff has done something well, it's good for them to be praised, especially when it comes to PBS. So coaching translates theory to practice. So this is a bit of a diagram that I put together just to kind of reinforce what I'm saying here. So you can see along the left-hand side, we've got going up, time spent with supported people. Along the bottom, from low to high, we have understanding of PBS. So at the top on the far left, the red circle, staff who provide daily support. Some of our staff teams are spending 10, 12, 14 hours a day with the people we support. On the other end of the scale, we have PBS practitioners who, unless you have, and this may not apply to you, if you have a PBS practitioner based within a service, this what I'm talking about right now may not relate to yourselves. However, from what I've seen myself, you'll have a PBS practitioner who has a geographical area that they cover. So PBS practitioners, high level of knowledge and understanding regarding PBS, but they do not spend as much time with the people we support. So there's a gap here. There's a very big gap. However, that's where I feel practice leadership comes in the middle, to provide that support to make this work as it should. Because if there's no practice leadership involved in the middle to kind of take the strain, I do not believe that PBS will be delivered as well as it could be. So my personal view is it's good practice to have somebody who has some PBS related knowledge within each service. To what level knowledge wise, that's up to the organization, where you should have somebody there who can provide, coaching and mentoring for frontline staff members within the service. So another poll: PBS wise, how important is it that practice leadership takes place regularly? So 100% said it is important. Is there a lack of active support across our sector? So there is a lot of research related evidence that suggests that when people are engaged, behaviors of concern are less likely. So the following slide shows some data from a study. So on the left-hand side, this is when there was no active support in place versus the right-hand side where there was active support in place. So you can see clearly that when there's no active support in place, there's more incidents, there's a higher frequency of incidents. So an incident for me is when somebody's communicating, have an unmet need. If you go onto the right-hand side where active support was in place, there is, I'd say, a significant decrease in the number of incidents, which means for me personally that people were getting their needs met because they were engaged, etc. So if active support does reduce the likelihood of behaviors of concern, what rationale can we use for not having it in place? So if this statement is correct, and we know that it reduces behaviors of concern slash incidents, if we know that and there's a direct correlation, are we not morally obligated to ensure that active support is in place? And active support is not something that you can just implement, in a day or two and leave it and that's it. It's a big piece of work, but with the data that I've just shown, it's well worth it. And I think active support is something as a sector we need to pay much, much more attention to. I'd go as far as to say that I know that is the case. So another poll, it may be the last one, don't worry. Is active support an element of PBS which is generally not given the attention it deserves? So 94% said yes, 0% no, 6% said what is active support? So PBS related data. So the data that is collected on a day-to-day basis is what helps PBS practitioners find out, how can we look into getting an unmet need met ultimately to improve people's quality of life, and there's other things to it. So when I was a support worker, I didn't appreciate the importance of this data, of filling ABC forms in correctly, filling in incident forms correctly, doing it properly, and I didn't appreciate that. So shouldn't we be involving staff and informing them as to how this data is used to help ensure that they're filling out documentation correctly day to day? Because if I was a support worker and I would have been shown that historically, and I would have seen how important that is and how that can directly improve the quality of life of the person we support, I would have been completing documentation better just for knowing that fact. So can we improve data capturing PBS wise if we explain to staff how it ultimately improves quality of life? 87% said yes, 13% said no. So I really hope you enjoyed listening to my presentation today and that was meaningful. Please do tune into the Just Care podcast where we discuss quality of life. It's available on Spotify, and I do post links weekly on my LinkedIn account as well. So they are basically they come out every week on a Tuesday. So I hope you enjoyed my presentation. I really enjoyed presenting it, and I think there's a lot of changes to be made. So let's get on with it, shall we? Thank you so much.